Good afternoon, Chairman, Co-Chairman, and my esteemed colleagues. My name is Piyatragun Pongsuksawang, a fourth-year resident from Maharashtra Hospital. Today, I'm honored to present my research title, Pauwels screw combined with inverted triangle multiple screws versus dynamic hip screw for femoral neck fracture, Pauwels classification 2 and 3. This is a prospective randomized controlled trial. The study has been conducted under the supervision of Dr. Naripon Rungsilapanan. Femoral neck fracture in younger adults often caused by high-energy trauma and can lead to serious complications, including avascular necrosis and non-union. While the dynamic hip screw is a standard option for high-power type, it has limitations in unstable fractures such as insufficient rotational stability and technical challenges in some patients. An alternative technique using Pauwels screw combined with inverted triangle multiple screw offers better stability for vertical fractures. However, it comes with challenges like a steep learning curve and variable clinical outcomes. Prior studies have shown that Pauwels screw combined with inverted triangle configuration of multiple screw offers several advantages, which are effective in maintaining reduction, provide good mechanical stability, offer minimal blood loss and short operative time, also small incision, cost-effective and widely available, and also adjustable neck shaft angle. But there's still a gap of knowledge as no randomized control trial or mechanical study has yet compared the outcomes of a dynamic hip screw and Pauwels screw with inverted triangle multiple screws. The primary objective of this study is to assess fixation failure at 12 weeks post-operative, and secondary objectives include operative time, intraoperative blood loss, length of hospital stay, quality of reduction score, complications, and functional outcome using the Harris Hip score. Here is the summary of our study protocol with the follow-up evaluation at 6 weeks and 12 weeks. Our study design was a prospective single-blind randomized control trial. The study population consisted of 36 patients who underwent fixation at Maharashtra Hospital from August 2022 to July 2024. The inclusion criteria was a patient aged 16 to 60-year-old with ability to walk before trauma and had operated within 2 weeks of injury. The patients that had BMI over 40 kg per meter square, pathologic fracture including low energy trauma fracture or osteoporotic fracture, active substance abuse, contralateral hip issue, and delayed ambulation due to multiple injury were excluded from the study. The patients were randomized using a computer-generated sequence and received sealed envelope indicating which implant to use after spinal anesthesia was administered. The operation was performed by experienced trauma orthopedists from our institution. Regarding the surgical technique for the Pauwels screw, we first insert a guide wire for temporary fixation. Then we apply the Pauwels screw perpendicular to the fracture site. While ensuring compression at the fracture site, we remove the first guide wire, and finally we insert multiple screws in an inverted triangle configuration. If the fracture is irreducible, we perform open reduction using the minimally invasive Watson-Jones approach. During data collection, one patient in the Pauwels screw group was lost to follow-up. The data were collected and analyzed using an independent t-test for continuous variables and chi-square test for categorical variables. This is demographic data of the patients. As you can see, the baseline characteristics of the patient were not different between two groups. And for the primary outcome, fixation failure occurred in 5.9% of the Pauwels screw group and 11.1% of the dynamic hip screw group. And for the secondary outcomes, we found that intraoperative blood loss and length of hospital stay in Pauwels screw group was statistically significant lesser than dynamic hip screw group, and other parameters were comparable between two groups. While the functional outcomes at 6 weeks and 12 weeks post-operative as measured by the Harris hip score were slightly better in the Pauwels screw group. To be concluded, from our study, the Pauwels screw combined with inverted triangle multiple screw show better outcome in less intraoperative blood loss and also shorter hospital stay. Both techniques have comparable operative times, complications, and early functional outcomes. This study suggests that the Pauwels screw combined with inverted triangle multiple screw is a viable option alongside dynamic hip screw and also femoral neck system for high Pauwels type femoral neck fracture. Thank you for your attention.